right, everyone. Welcome back. This is your host, Mark Cuccinella, and I'm happy to say that we've got Dr. Timothy Ryan on the line to discuss the recent events regarding the COVID pandemic. Good afternoon, Dr. Ryan.
Afternoon, Mark. Thanks for having me.
Oh, yes. Well, thank you so much for taking time out of your schedule. I know you haven't had lunch yet. We'll try to make this as brief as possible, but of course, we've got the news out of the CDC that is rippling across the country, and people are reacting in many strange and non-productive ways. I just want to start by addressing a problem for me. I want very much to follow the advice of leadership in this country and to have confidence in the institutions that guide our progress, let's call it. The CDC has made one mistake after another through this pandemic, beginning with the reluctance to accept the testing that had been developed by WHO, and so on and so forth. We don't have to categorize all of their mistakes, but what is going on with the CDC that they couldn't see that people are going to just disregard all the advice that has been given regarding masks and social distancing? What's up?
Well, I think, Mark, to be quite honest, I think what the CDC did was to focus primarily or only on the clinical aspect of getting vaccinated, right, and to educate and inform the general public that if you are vaccinated, you have a 90 to 95% protection in the sort of the benefits of doing that. What the CDC failed to take into consideration, and more importantly, to share with the general population, is really the behavioral aspect of that, the clinical side of that equation, because it's very relevant. 37% of Americans who are above the age of 12 are currently fully vaccinated, woefully short of where we need to be. And the rest of them are either in the process or aren't going to get vaccinated. And what it's done is it's opened the door to tens of millions of people who aren't going to get vaccinated to, in essence, lie about their vaccine status, and subsequently putting the rest of us back at risk. We have gotten ourselves vaccinated for our own personal protection, but also for many of us, more importantly, for the broader community and helping to protect the broader community, particularly those who can't get vaccinated, who have an actual medical reason or rationale for not getting vaccinated. So I think, unfortunately, this advice was misguided and didn't take into consideration the unintended consequences, meaning people will see that this is a reason, a rationale, or justification for why they no longer need to wear a mask. I think what you're going to see in spades is come fall, as we saw last year, the case counts went down because people moved outside during the warmer months and didn't congregate inside, so our case counts declined over June, July, and August. But what we saw last fall was a significant increase in spike in cases as people moved indoors. And now that we've, in essence, removed the mask mandate, and it sounds like this county is on the way to doing that, what you're going to see is a spike in cases. Particularly troubling is potential variants that are literally, as we speak, developing in places like Brazil and India, and not knowing what those are going to come. So putting that cat back in the bag, meaning requiring masks again in the fall, is going to be particularly difficult, if not impossible. And it will create likely a scenario in the fall that is to deal with that. As a public health director, it is incredibly frustrating. As you see on the news when they say public health, announcement. There's a reason for most people in public. This is why here
I check every day rates, and with now the state of Colorado case evidence of any and of eliminating our mask mandate. It's insane to me. And by the way, when it comes to wearing a mask, I should ask you a question, but I don't know what to ask you other than could you get for continuing?
I sure know that in a number of studies, we now know that just looking at the influenza data, for instance, the impact that mask wearing nationally has had on the influenza rates this year and deaths is incredibly impactful, to the point where influenza played very, very little role, if any, in cases and fatalities in this country. All of that is attributed to masks. So to systematically eliminate one of the tools that public health has been using for the last 14 months to protect the citizens of this country, to your point, is insane. I wouldn't do it. It is not my advice or my suggestion to do that. I'm not going to do something just because our neighbors are doing it and have indicated that they don't want to do it anymore. I'm as tired as anyone who's wearing a mask, but guess what? It's not a huge ask for me. It has no economic impact whatsoever. And in public health, we don't change our perspective or our guidance because people just don't want to do something or are tired of it. I understand that completely. But that isn't how I make decisions. It's not how I decide what my recommendations or guidance is. I know conclusively, fact-based, 110%, that masks are incredibly effective at protecting people from this virus. And why we would systematically throw one of the tools away that has been incredibly helpful, particularly in this county, is beyond me. And I might add, it is not on me anymore. If the board decides to go against my guidance and recommendations, any increases moving forward, citizens need to ask them for rationale and justification for doing that, other than people are tired of it and everyone around us did it. So that's where we stand. I don't, I can only provide guidance and recommendations. Boards of health across the state can choose to ignore them. There's nothing I can do about that.
Dr. Ryan, I know you deal with statistics and broad analysis, but and anecdotes are not that useful. But I have to share this with you. When I became vaccinated and fully vaccinated after 2 weeks subsequent to my second shot, I decided to come back out into the gym environment. I love, as I've told you before, I love to go to the gym. I'm a gym rat. I have a gym in Denver. I go to the rec center here, and I go on Sundays to Denver, and so this past Sunday was my first trip down there at post CDC proclamation. And I suspected the worst, and when I got there, it was confirmed. 20 people in this gym, not one person with a mask on. Now, this is a population of 20 and 30, early 40-year-olds primarily. I'm by far the oldest guy in the gym, and I know that that is not a vaccinated population. There's no question in my mind they're unvaccinated. And so I had to turn around and leave, and I canceled my my membership to that gym I'm hoping that's not going to happen to the rec center here. I'm hoping that there can be some carve-outs when this decision is made to recognize the greater danger in certain environments. All indoor environments are more dangerous. We know that. But within that subset of opportunities for spread of the virus, there are certain places that are more dangerous than others, and I think that gyms are near the top of the list. What do you think?
Yeah, I think, Mark, no matter where you go, what you need to keep in mind is if you walk into a place and 100% of people are not wearing masks, you can be 100% assured that there are individuals in there who are unvaccinated, whether it's at the gym or a grocery store or wherever, as only 40% of Coloradans are fully vaccinated. So there's no reason to believe, whether you're in a grocery store or a gym, if 100% of the people in there are unmasked, roughly 60% of them are probably lying to themselves and to those around them. So rightly so. I, in your situation, if I walked into my gym, which my gym is outside, and I saw 100% people unmasked, I would turn around and walk out as well, because it presents a risk to you, and it presents a risk to everybody in there. And so there are certainly places that are more risky, bars among them, right? You have lots of people packed in tight drinking, and the more they drink and the tighter it gets, the closer you get. And now you're 7 inches away from somebody shouting at them. And so, in my opinion, and this bears out in the facts, bars are by far the riskiest places to hang out and hang out with other people. So it's really about taking personal responsibility and going into places. And if you see 100% of people, I would turn right around and walk out, regardless of whether it's a grocery store or a bar or a gym, for that matter.
Well, I think back to when there was resistance to even wearing masks last fall, let's say, and or last spring, as a matter of fact. And I remember saying to myself, my strategy is going to be the looser the regulations become, the more I have to lock down. The less money I'm going to spend at local establishments, the less I'm going to be out in public, because the danger is increased. Now that I'm vaccinated, I feel reasonably secure in myself, but the public is remains in danger. And I heard one of the county commissioners talking about people who have had COVID, and now they have some level of immunity based on the antibodies they've produced. Nobody has a clear idea of what level of immunity or for how long that is. So I go by who's vaccinated, and that's the number that I'm going by. And if people are going to be out without masks, I'm not going in. It's just that simple. And I don't know what else to say about that. Let's move on. I wanted to one more time give everyone the chance to hear us talk about the COVID Vax line. That's the number where they can call and sign up if they would like. Although they can just drop in, is that correct, to the vaccination site tomorrow in Dumont?
Yep, absolutely. So tomorrow we will be in Dumont from 9 a.m. to 11 a.m. We will be offering the Moderna, J&J, and Pfizer vaccine. All three will be available. If you're unvaccinated or know somebody, please encourage them to go. We will be offering those three there and those dates. For those times. The COVID Vax line, as you stated, that number is 303-670-7528. That's 303-670-7528. And that number is manned by someone every day, Monday through Friday, 8 to 4:30. Jennifer is the person who answers that. She'd be more than happy to help you, let you know what's happening, and get you signed up for that. Walk-ins are also encouraged and welcomed at any one of our test sites. This weekend on Saturday, we will be in St. Mary, Dallas. doing a clinic up there, and then next week we will be in Empire having a clinic there as well.
Well, that's great news. And so this weekend up at St. Mary's, there's going to be a vaccination clinic. And what time will that start and run till?
That is a great question, and I will have to look at our website. I don't know the exact time. I don't want to say something and then be wrong.
Well, let's just recommend that folks call that 303-670-7528, and they can get all the information regarding this Saturday's vaccine extravaganza up at St. Mary's. And then you said next week in Empire. Is that right?
Yep, correct. Actually, I have the times here now. So St. Mary's Glacier, it will be from 11 a.m. to 1 p.m. At the Metro building there in St. Mary's Alice, 463 Silver Creek Road. And then the one in Empire, the 26th, the following Wednesday, it will be at Theobald Park Avenue there at 10 a.m. to noon. Walk-in as well.
Okay, that sounds great. And now, Dr. Ryan, I was thinking of getting a COVID test. Even though I've been vaccinated, there have been breakthrough cases. And I was thinking about going today. This is Tuesday, and I believe it's from 10 to 2 at the EMS station on 103. Is that correct?
That's correct, yep. We're still doing that, and it might be moving literally across the street over to the old school parking lot, also on 103 in the coming weeks because of the rafting traffic that'll be taking place. So we're just going to be moving the testing across the street, but that, again, will happen every Tuesday from 10 to 2 going forward.
Yeah, that makes a lot of sense. That's going to get pretty hectic down there in that area very soon. Well, I just have one last thing that I want to bring up to you and get your comments. Way back in January, I first said to you, what do you think about a vaccine passport? And you weren't too keen on the idea at the time. I wonder if your ideas have changed in the interim.
You know, the concept of a passport and the concept of proof of vaccination makes sense on several levels. Just as an example, my daughter will be traveling overseas this summer through an educational program, but she has to show proof, not only her CDC card, but also several other proof that she has, in fact, received the vaccine. Including the state of Colorado printout of her immunization. So they know full aware that there are fake vaccination cards out there that people can buy online, which gets to my point about people lying about their vaccination status. So from an international perspective, for the most part, it depends on where you go, that is required, and it makes sense. Many of these countries are not wanting individuals who are unvaccinated and posing a potential risk to their country. So in this country, it is highly unlikely, given what's happened over the last week. As an example, I don't see in this country where the notion is me, myself, and I, and the sort of individualism that we celebrate and is, in my opinion, our Achilles heel. I don't really see a vaccine passport happening anytime soon. It doesn't necessarily make sense from this perspective or this point, and also what it would be needed for. People in this country are free to travel every day, anywhere in the country, and so requiring any sort of proof. I think the situation we're in now, where you have governors who are declaring the pandemic basically over. Our governor is no exception to that, in mandating that if 80% of people are vaccinated, but speaking nothing of methods or ways or tools for us to determine that. It suggests that a passport isn't anywhere on the horizon anytime soon, nor do I think the politicians have what it takes from a public health perspective and concern for citizens to mandate anything like that moving forward.
Well, I'm happy for your daughter, and I hope to travel very soon to Italy. I've got a pilgrimage, a 200-mile trek that I've been planning all winter long and dreaming of going on. And as soon as they let me, as I figure out all of the details, I'm sure that your daughter will get it right. I'm hoping to do the same, but I feel safe enough if I know that those sorts of strict guidelines are in place. Then I think that we can all be comfortable in opening up our lives. It's this mad rush to open up without regard to the dangers that are presented to the general public. That's what is so maddening to me, and I'm sure to you, and I wouldn't want to be in your shoes with that heavy responsibility. Dr. Ryan, thank you so much for your time, and my apologies for not much of an interview today. It was more of a rant, and I promise I'll do better next time.
Yeah, no worries, Mark. You're entitled. The only thing I would say in closing is that the Pfizer vaccine is readily available in our county through the Safeway in Idaho Springs and the Safeway in Evergreen and Walmart in Evergreen. So if whoever's listening has individuals, neighbors, friends who have individuals who are 12 and above, they can go and walk in. They don't need an appointment. They just show up at Safeway before 4:30 in the afternoon on most days, and they will be able to get their child vaccinated. And so that's a change in what's happened. And we did vaccinate a number of kids in middle school and high school yesterday. And hopefully that goes a long way towards providing a more normal fall and one that will not include masks.
Well, that's certainly great news that we've got those children vaccinated, and please, everyone out there, take advantage of the vaccines that are available. It's so easy. And you'll feel great about yourself and what you've done for your community. Dr. Ryan, thanks for joining us. We'll talk to you again soon, I hope.
Thanks, Mark. Take care. Right. Be well.
All right, everyone. That was Dr. Timothy Ryan, and I apologize to him, and I'll apologize to you. I did a lot of ranting, raving, and editorializing, but I think the country is making a big mistake, and I would encourage everyone to continue their efforts to keep themselves and their loved ones safe and secure until we can get a hold on this pandemic, which is going to be some years from now, it looks like. See you next week.